Chapter 14: Symptoms and Signs. A. Describing problems. The problems which a patient report to the doctor are called symptoms. For example, pain or nausea. Signs are what the doctor finds, also known as finding, on examining the patient. For example, high blood pressure or a rapid pulse rate. Symptoms are also known as complaints. To report a patient's symptoms or complaints, doctors say, Mr. Farber was admitted complaining of chest pain. In case notes, the abbreviation C/O is used. C/O chest pain. B. Presentation. Patients say they went to see the doctor. Doctors say the patient presented. The symptom which causes a patient to visit a doctor or to present is called the presenting symptom. Presenting complaint or presentation. His presenting symptom was chest pain. His presenting complaint was chest pain. He presented to his GP with chest pain. The usual presentation is chest pain. C. Talking about symptoms. Symptom: tiredness, lethargy, fatigue, latitude. Meaning: loss of energy. Patients say, I feel tired all the time. I feel completely worn out. Literally, if being feeling completely exhausted at the end of the day. Symptom: malaise, meaning general feeling of being unwell. Patients say, I feel unwell. I don't feel well. I've been feeling of color for 2 days. I haven't been feeling myself of awake. I've been out of sorts all day. Anorexia, meaning loss of appetite. Patients say, my appetite is very poor. I've been off my food for days. Symptom: weight gain, increase in weight. Patients say, I've put on 8 kilos in the last year. I've gained 5 kilos. Symptom: weight loss, meaning decrease in weight. Patients say, I'm not eating any less than usual, but I've lost a lot of weight recently. Symptom: constipation, hard, infrequent feces. Patients say, my motions are very hard. If being quiet, constipate, literally. I'm not very regular. Note: the verb feel is also used with other adjectives, such as hot, cold, nervous, anxious, dizzy, weak. She said she felt dizzy. 14.1. Complete the table with words from the opposite. Put a stress mark in front of the stress syllable in each word. The first one has been done for you. Exhaustion, exhausted. Fatigue, fatigued. Lethargy, lethargic. Tiredness, tired. 14.2. Make word combination using a word from each box. Complain of color, out of sorts, present with, put on, worn out. 14.3. Complete the sentences with the correct form of the verb present. A 67-year-old man presented with a 9-month history of increasing shortness of breath. The most common presentation is loss of consciousness. Cranial arteritis may present as fever without any obvious cause. The patient usually presents with a severe sore throat. The presentation symptoms in this patient could perhaps be due to renal failure. Other conditions with a similar presentation include acute cholecystitis. Reduced growth is an important presentation complaint of celiac disease. 2 months following presentation, the patient was able to walk. 14.4. Read the patient's description of her symptoms, then complete the case report. I was well until a few months ago. In the beginning, I just felt off color and a bit tired. But latterly, I've been feeling completely worn out at the end of the day. I'm not eating any more than usual, but I've put on 9 kilos in the last year. My emotions are hard and my hair has started to fall out. Case 13. A 50-year-old housewife who had been well until 4 months previously, feeling off color, of tiredness, she had gained 9 kilograms in weight in the year before she presented to her GP, although he didn't eating more than usual. She was constipated and she noticed that her hand started to fall out.